All right. Good morning and welcome to our Harlem Emergency Network COVID-19 weekly update. Hello, Carol. How are you?
I'm just fine, Bob. Got good
Good.
rest last night. I'm doing well.
All right. I'm glad to hear that. So, let's get into today's stories. I wish we could. I wish this was like a good news broadcast,
Yeah,
but if it was, I guess we wouldn't have to do it.
right.
So we want to start out with some projections here. Now we already know that we are edging up on the 200,000 mark in terms of people in the United States who have died from COVID-19. But it doesn't seem like people are talking about the projections that we are projected to pass 410,000 by year end. So I want to get into some detail here on this. So this projection is interesting. I'm reading this article. This article is actually from Australia. It's from the Sydney Morning Herald. So it seems like other people's press are paying more attention to our numbers than we are. Um, but the numbers are not coming from Australia at all. They're coming from the University of Washington's Health Institute. And so they're saying that U.S. deaths can reach 410,000 by the end of the year, which is more than double what it is now. And deaths could soar to 3,000 per day in December. And what they're also saying is that this number could be reduced by 30% if more Americans wore face masks, as epidemiologists have advised. But evidently, people have already gotten tired of wearing masks, even though deaths have been going up. And you know, 3,000 people a day is just a crazy number. Um, Having 410,000 people dead by the end of the year is also crazy. But the thing about this particular institute, they've been very, very accurate. And here I'm reading from this article. The institute made waves earlier this year when its aggressive forecasts contrasted with President Donald Trump's repeated statements that the coronavirus would disappear. But deaths have surpassed some of the institute's dire predictions, which have been frequently updated to reflect new data. So basically, what's happening is that they've been making projections all year, and they seem to be aggressive, but we seem to have blown by them. So we have to really pay attention to them because they've got a track record of being accurate, but unfortunately, because of the knuckleheadedness of this administration, we've blown by those numbers. Yeah,
You know,
crazy.
it's crazy. It's even crazier because I get that, things have changed. We've never been here before. I
Mm-hmm.
get that. Things have slowed down. The curve, we hit a curve and all of that. But the question is, you're tired of wearing masks, but are you tired of living?
Mm-hmm.
Because people are still dying. All of
Mm-hmm.
those states that they had very low infection rates are now rising at rapid paces.
Mm-hmm.
And one of the main reasons is because of these social gatherings. Masses of people getting together, not wearing masks, head to head taking pictures. Let's not forget, let's not get caught up in the fact that family members cannot infect you.
Mm-hmm.
You know, it's not, it doesn't respect your mother, your father, your sisters, your brothers, your cousins. It doesn't, has no respect for any familial attachment. They can be asymptomatic, and so can you.
Mm-hmm.
And you can easily pass this on. And I'm seeing a lot of gatherings with a lot of children. Like they said, children are super breeders, and they
Mm-hmm.
may too be asymptomatic.
Mm-hmm.
But we got to be careful. I'm waiting for the projections now from Labor Day. alone. They haven't come in yet, but I'm waiting
Mhm.
for those projections.
Right. So you brought up a couple of things that lead into some of our other stories. So I'll start with this one. Over 500,000 children have been diagnosed with COVID-19. So let's look at this story here. Also, this is a story that CNN has been picking up. And so, according to American Academy of Pediatrics and the Children's Hospital Association, 500,000 children have been diagnosed, and that includes 70,630 new child cases reported from August 20th through September 3rd. And so, this is a 16% increase in child cases over 2 weeks, bringing it up to this total of 513,000, and this is before the schools opened up. So it just really points to the danger because kids because of their activity, they spread. You know, kids go places, they run places, they get into stuff, and then they bring it home. And that's just life as we know it. And the the early assumptions that kids couldn't get this, we've now dispelled that myth, unfortunately, in a way that we didn't want to, because we found that kids can die from it. Kids have different reactions to it, and so while their systems may not be as easily compromised as somebody who has pre-existing conditions, the fact is that we are way too early to understand what the long-term effects on children of COVID-19 are going to be. And we just recommend that people just need to be really more serious. Yeah, I still see parents out there wearing a mask, and their child's not wearing a mask, and I don't understand. That just doesn't make any sense to me.
Yeah, we have to realize that kids have a different immune system too. I
Hmm.
remember early on when children were getting affected, their symptoms was much more serious than what was happening to adults.
Hmm.
Now that's sort of leveled off, but at the same time, like you said, long-term effects.
Hmm.
We just have to remain conscious of what our kids are doing, where they're going,
Hmm.
the close contact with other people. We're still doing fist bumps and elbow bumps and waves.
Hmm.
But and yes, it's difficult. It's
Hmm.
difficult. But if we want to really maintain the curve, because the numbers are rising in New York, let's face it.
Hmm.
You know, And if we really, really want to maintain this curve, we haven't gotten to a dangerous point yet. But they are expecting a wave
Hmm.
to take place as fall comes in. We're at at the end of the summer. Fall is
Hmm.
approaching, and they are expecting a wave. That is the scary part. That's
Hmm.
why you really need to take more action in protecting yourself and those around you.
Hmm. And that's a reminder that the New York City schools have not opened yet. That opening has been delayed until September 21st. And so we are encouraging people to really look at how this process is going. And it's not just it's not safe to just assume that the school's protocols are going to help you or save you. I think everybody needs to come up with their own protocols. If they're doing this, and if you're sending your kid to school and they're coming home, you better instruct them how to appropriately behave, what is safe and not unsafe behavior. And I think people need to start to develop protocols about people coming back into their own homes. And we talked about this at the height of the infection here in New York, about how no one was instructing people for home protocols. And now that we're in the summer, people feel like it's time to relax. But now we're going into fall, and it's time to raise your threat level. And so you really need to make sure that if you're sending your kid off to school every day, they're coming home, they're taking their shoes off at the door, they're washing their hands immediately when they get in. You got to give them instructions on what's safe wearing masks. There's a meme floating around social media that is so it's kind of it's humorous, but it's not. And so it's where a kid comes home and the mother is saying, um, the mask you're wearing, that's not the mask that I sent you to school with. And the kid is like, no, I got a much cooler mask. I traded it with Taylor, and Taylor traded it with Amy or whatever. And so it just highlighted the fact that kids will do things that you might not predict. And if you don't explain to them the importance that no, don't trade your mask with anybody, even if somebody else has the Spider-Man mask or whatever, that's not what we do. It's just as important to educate your kids about safety protocols as it is to use them yourself.
Absolutely, because that's what kids do. They share.
Mm-hmm.
They don't understand it. And I know like this is an adult thing and children,
Mm-hmm.
it's hard to get the children to understand it, but you've got to find some kind of way to get through to them.
Mm-hmm.
It's simple, that a 2-year-old can understand it, that you just can't do things
Mm-hmm.
now the
Right.
way you used to.
Right.
You don't hit them with a forever theory, but right now you can't do that,
Mm-hmm.
until it's, safe.
Right.
But you don't even have to add the safe part. But right now you just can't do that. You can't
Right.
get things, you can't eat behind um your friends or drink behind, which you shouldn't be doing anyway, but that's what children do.
Right, right. And we got a note from our brother Mark McPhee, who reminded us that the other early myth was that black people couldn't get it, and we saw how that turned out. So, we're here to get rid of the myths and stay focused on what the real story is and the real data is. And so, going back to the whole issue of family thing, we want to talk about a situation that happened up in Maine. Um, where there was a wedding, and you know, from this wedding, which was in August, 147 cases and 3 deaths linked to this wedding, which is in August. And so again, we have to remind people that being with your family, we all want to be with our family. I haven't seen my mom in months, but I don't want to go and put her in a situation where I could be compromising her health. And so I haven't had the opportunity to do that, but we talk on the phone and we can FaceTime and do all that. But I put her health above, that momentary, wanting to spend time with her. That's not going to, I'm not going to enjoy that if weeks later I find that I might have compromised her. So here's this situation. Main wedding reception. This wedding was like on August 7th, and what happened was since then they've traced it to spreading to a nursing home and a prison that are both more than 100 miles away from the venue. You know, and so these are these situations, and again, these people are out in Maine. They're like, well, it's not really out here, and we're out in the middle of nowhere. And this COVID travels. This COVID gets around. Um, and people who are thinking that for some reason they're safe from it, or this insane idea that because it came through New York, it can't come back. Everybody comes back to New York. Everything comes back to New York. And so it's really very optimistically irresponsible to think that COVID is not going to make another appearance. COVID is like on the world tour here. You know, it's it's like those shows before they come to Broadway. They go to go to the small town. Well, COVID came to Broadway first, and then it's going to the small towns, and then it's coming back. And we're not trying to wish bad wishes on New York. Certainly, we're not. But we have to we have to really pay attention to what the data is telling us.
Right, and you have to be able to speak up for yourself. You go to a venue and you see there's no social distancing, or people are not respectful of wearing masks. You see a crowd. I mean, let's face it. You have a lot of restaurants that they've got their outdoor cafes, and now they've got street cafes. But if you
Hmm.
plan to go somewhere and you see the people are very close, the tables aren't separated the way they should be, reconsider going there.
Hmm.
There's a lot of places here in East Harlem. I mean, literally, everybody's lined up at tables.
Hmm.
There's barely like 2 inches between the chairs.
Hmm.
See that that's the situation. I mean, think. You've got to think. If that's the case, make a change of plans and go to somebody's house and get takeout.
Hmm.
But this is the problem that took place in Maine. You had a place who had a limited amount of people that were
Hmm.
allowed to be in there. They more than doubled the amount, and that's what you ended up with. All of those people infected. And that's just now. That's what we know now. But you
Hmm.
go to a nursing home with all of these people that's highly susceptible, and in a jail situation where people are also highly susceptible. So we
Hmm.
don't know how far that's going to morph.
Hmm.
But we got to stay away from those crowds, no matter what. You know,
Yeah.
Aunt Janie can't understand. Well, Aunt Janie, I'm gonna have to call you, but I can't do this.
Right. We can't emphasize enough that people got to have to use a higher level of common sense to protect themselves. Because we're in an environment where we still have a federal government administration that's trying to act like this is not going on. They're trying to minimize what's going on, and they have not taken the steps to end this thing. And so the thing we know for sure is that there's really not going to be any real positive push to end this thing between now and November, other than the fact that they are rushing vaccines they're trying to rush testing. I'm going to talk about that for a little bit. I didn't even really line that up as one of our stories, but I want to show you something here. So there's a story. CNN is reporting that the vaccine manufacturers are now pledging some sort of safety pledge, and they're promising to uphold high ethical standards. And it's a joint pledge by the vaccine members makers, and I think it's basically a response to the fact that they know that the president is pushing for a vaccine by November 3rd. And they know that people are like, okay, we don't trust it. And the trust factor for a vaccine I feel, is very, very low right now. I know I don't particularly trust the situation. And I really don't trust it when I see this particular story. Let me actually I want to make sure that I want to play a video, but I want to make sure that we can actually hear the sound on this. So let me do this again. So I found it interesting in this situation that they've come up with somebody they're calling her the Neil Armstrong of COVID-19, because she is the first person to go into a phase 3 clinical trial of a vaccine. And I love how people put language. I would call her the canary that's in the coal mine, but they want to say like she's Neil Armstrong. She's walking upon the moon. And of course, she is a black woman. So let's take a look at this
news anchor in Savannah, Georgia, could be the Neil Armstrong of the coronavirus vaccine. This summer, Baker became the first person in the U.S. to take part in a phase 3 clinical trial for a vaccine against COVID-19. She was asked by CNN's Elizabeth Cohen how it felt.
It is very exciting. I'm very anxious about it. I just hope that they're really, really good results. I know a lot of people are doing a lot of different vaccine trials and things are going on, but number one, I feel so proud.
All right, I'm going to stop that right there, and let's just talk about that. I just really think it's very, very interesting and telling that they should pick a Black woman news anchor to be the first person. And it's like PR to say, look, see how safe it is. We got a Black woman, and she's going to be the first person to test it out. She's the Neil Armstrong. She's walking on the moon. No, she's the canary. She's in the coal mine. She's there to tell us if it's safe or not. And I mean, I don't have, and this is not meant to disrespect her in any way. People make their own personal decisions. But I just look at the optics of these things, and I see that they're trying to rush us into a comfort level of a vaccine situation that clearly anyone who has done any research on just the process of bringing a vaccine safely to the market knows that they are basically throwing safety out the window to try to get something done speedily. And certainly there is a lot of pressure under this administration to get something done by the election so that they can claim a win and somehow claim that this administration beat COVID-19. And clearly with 200,000 people dead and looking for that to double by the end of the year, according to the University of Washington, that's not the case.
Right, and let's backtrack. Where the administration was trying to rush, not only rush the vaccine, but the first thing that he said was, we're going to give it to people in prisons and in Chicago.
Mm-hmm.
Now, who are we talking about? And it's ironic because, Chicago now is supposed to be known as the epicenter of crime and shootings and killings.
Mm-hmm.
So it's ironic that he would say Chicago, of all places, and the prisons. Well, we know because of systemic racism who's loading up the prisons. So again, you're talking about Black and brown people.
Mm-hmm.
Now here they show this Black woman taking this trial. And again, he's pushing to get the confidence of Black people, Black and brown people, to say, well, look, this newscaster is doing it. Of course it's safe. We got to be very skeptical. It's of this administration and when we're being used.
Mm-hmm.
And at this point, we're being used at every turn. I don't trust anything that comes out of his mouth.
Mm-hmm.
And I don't trust anything that he tries to pull us into. So yeah, there's a lot of skepticism. You've got the rich guy, Bill Gates.
Mm-hmm.
So everybody's pushing for Black and brown people to be the trial, test animals.
And then trying to tell us it's all of a sudden, we've got to help the poor folks who didn't have access to it. We've got to make sure that they get access first. And it's like, no, we have to make sure that they're the guinea pigs, the crash test dummies, and we want to open up that market because that's, at the end of the day, there's always seems to be a profit motive and incentive for the solutions that are being brought to bear. And we've been saying this since day one, and I'm not here to pat ourselves on the back or toot our own horn, but the things we were saying in March have been verified by research. We said from day one that people need to be about boosting up their immune system to fight this. And we said it in March because we figured it out. That's the only solution that we could actually get to people in the midst of a crisis, but it's still the best solution. As we're going into September and the weather is about to be cold and we're going to be spending more time indoors, it is more and more critical right now to start your program to boost your immune system. If you haven't done it already, you need to start it right now. Period.
Yeah. I mean, it's just that simple process. And now, remembering that even when COVID began, the weather had already begun to break.
Mm-hmm.
It was getting warmer at that time. So we haven't seen it in really, really cold days,
Mm-hmm.
like we're about to see. So,
Right.
yeah, all going to be on lockdown again.
Mm-hmm.
Real lockdown, because when it gets cold, where are you going? Nothing's open.
Mm-hmm.
So you're going to have to really, really, really work hard to remember those protocols. Go back to the beginning. The sanitizing of frequently touched items. Keeping an eye on people.
Mm-hmm.
Checking your children for different symptoms. Are they all of a sudden quiet? Are they lethargic? Are they listless? The elders as well. Are they changing? Are their habits changing? You got to really start paying attention. And, start now finding things to do. You have to be a little more creative than you were past winters, because now it's a matter of not being able to go out because you'll have no place to go.
Mm-hmm.
It was different in the wintertime before. You stayed in, you went ice skating, you went roller skating, you did whatever you did, museums or what have you. A lot of those places are still going to be closed. So now is the time to prepare. It's like when we teach about emergency preparation, we're like, imagine a situation, an emergency taking place. Well, now we are in the emergency, but this is the time to mitigate, to lessen the severity of the next wave. So go back to the beginning, monitoring and continue to wipe those items that you bring in from the store, and continue to sanitize frequently touch surfaces, your bathroom, get all your cleaning supplies. Now stuff is being more available in stores. Get that stuff in abundance. Get that extra water, extra non-perishable food. Make sure you have a first aid kit. We still don't want to go to the hospital if we don't have to.
Mm-hmm.
So, I mean, this is the time, and this is Emergency Preparation Month, National Emergency Preparation Month. So this is the time, it's not often that you get a chance to be in an emergency and actually still have an option to prepare. We usually do that ahead of time. But now that you've got this break, take advantage of it.
Right. And so you already know a lot of people got caught unawares in March, and all of a sudden we had a shutdown. Now we're looking at going into the cold weather. We're not hoping for another shutdown. But we're definitely planning for the possibility of one. So all the things that you didn't have in place in March, you can put them in place now. And so, do you have enough food and water in your house so that you can stay inside for a sustained amount of time? Do you have enough of the supplies that you need to keep your house free from infection? Do you have, and let's talk about masks for a second. So in general, we know that when everyone wear masks, it protects everyone. But we also know that in terms of specific protection to you as a person, the N95 masks are the ones that are most likely going to help you in event of a pandemic. And so there have been a bunch of mask giveaways. Some of them are surgical masks, which, again, surgical masks are made to protect the patients, not the doctors. But when everyone is wearing them, it protects the whole community. But you want to have some of those N95 and KN95 masks around, because if the threat level goes up, you should bring up your own level of awareness. And so I have some N95 masks. I have some other masks, but if the information gets out that we're starting to see the numbers climb up, I'm going to switch over to those N95 masks, which in the early part of the pandemic, it was it was suggested, implied, or told to us by the media that those are only for hospital workers. That is not a true statement. N95 masks have always been available. You could buy them before the pandemic. You could buy them in Dwayne Reed. You did not have to be a doctor. You did not have to show medical credentials. And we who are in the emergency preparedness community have always told people to have these masks in their go bag. So when the pandemic hit, most of the people who had been prepared with our trainings had N95 masks in their bag. A lot of them didn't even know because they've forgotten, but they were there. And so it's okay for you to get a better mask. And we suggest that you have them at the ready so that if things start to ramp up in terms of infection here in New York again, you can ramp up your own security. You should get the hand sanitizer now. You should continue to wash your hands consistently every time you walk into the house. You should pay attention to how you handle your shoes coming into the house. It's okay to go to the shoe protocol where you take your shoes off by the door and leave them there and go through a process where you actually clean the bottoms of your shoes that bring a lot of things into your home. This is not just good for COVID-19, it's good in general for health practices. But it's critical in an emergency that we ramp up what we're going to do. So we're going to continue to bring this message home because we want people to go into this fall period and going into the winter prepared. Because as we have said, these are not our. We didn't get up this morning to make up these projections. If we had no stories, we wouldn't even do this broadcast. I'm going to put something on. We got something from one of our listeners, William Murphy. He was saying, I've been in self quarantine since January, couldn't get masks for the longest time. I'm immunocompromised and maintain strict quarantine practices. So we applaud you, William Murphy, for just taking care of yourself. And we spread that information to understand that this is what we all need to be doing. That while people are running around not respecting the situation, they not only create opportunities for themselves to become infected, but they also create problems for the people in their lives. And so if you're going to be if you're going to not pay attention to things, there might be someone in your life who is immunocompromised who you may inadvertently infect. And, we don't want that. We've already lost way too many people this year to COVID-19. And we really are trying to do our best to really keep that to a minimum.
Yes, and thank you for that, Mr. Murray or Murphy?
Murphy.
Mr. Murphy. I too am immunocompromised, and I've been out there because I'm a response worker, but we have to take a little stricter precautions. I've kept people outside of away from my home, and so it's just me. I don't have that extra, travel of people in and out. So we have to just maintain that. But, like we said, we don't come to scare you. We come to prepare you. So it's very, very important that we remember that and maintain these protocols. And it is okay for you to go out. Even when I'm not working, I get out. I get my sunshine, my vitamin D. I take a little spin around the neighborhood. I stay away from crowds. I may sit in the park. And when I'm sitting in a spot where there's no one around me, yes, I can take my mask down, So we don't want people to feel locked up like you're caged within yourself. If you want to go into a park, just look and see where there's a bench that's, there's nobody around. Just sit there, take a book, read it, have some music. have a sandwich, whatever you have to do. But still just learn to live in the midst of this. People are dying, but we don't want you to think death. We want you to think that this is just a new way that we have to adapt to things. But please, by all means, go out, get that fresh air, and get that sun.
Right. And keep your social distance and keep your mask on. It's that simple. One more story, I think, and we're going to wrap this up. And this is that, and this points to a trend we've seen of our own local government telling us what a good job they're doing, and then we're getting information from otherwise. So we're seeing that the city is praising their contact tracing program, but workers who actually work on that program are saying it's a disaster. So let's see if we can get into a little bit more detail about this particular story. Let's see if I can bring this up on the screen. Where is it? Okay, here we go. So this is a New York Times article talking about the city's contact tracing program, and they interviewed a bunch of people who worked in the program, and they're more or less saying that they're putting out propaganda about how the program is effective. Here's one person who said, "I don't think this is the type of job we should just wing it." And that's the sense I'm getting sometimes. Somebody else said the lack of communication and organization is crazy. So these are things that we have to stay on our elected officials and government officials to actually deliver things that are working for us. And they continue to try to take victory laps and bows, but when we take a closer look at things, talking to people who actually work there, this is a quote: "It reminds me of an Amazon warehouse or something where we are judged more on call volume or case volume than the quality of conversations," one newly hired contact tracer, a public health graduate student, said in an interview. "To me, it seems like they hired all of us just to say we have 3,000 contact tracers so we can start opening up again, and they don't really care about the program metrics or whether it's a successful program." So these are some of the things that really disturb us, because contact tracing is kind of the linchpin to, in the toolkit for basically stemming a pandemic. Contact tracing is one of them, where they basically want to actively find everybody who is connected to somebody who's tested positive, to be able to trace them down, make sure they're quarantined, make sure they've got the medical treatment, and then trace who they know so you can actually stem the tide. We were disturbed earlier in the summer when the Department of Health, who has more experience in this stuff going back years and years and years and was qualified with this, and that the contact tracing responsibility was taken away from the Department of Health. And we still have never really gotten any kind of reasonable explanation as to why that's happened. And so that when we're now getting disturbing reports of people who actually work through the program who are not seeing this thing work smoothly, and then we can trace this back to the fact that the people who had the most experience with this, the Department of Health, they got it stripped from them, and it was handed to New York City Health and Hospitals Corporation, who, although they deal with medical challenges, but they've never had the specific focus on epidemiology and contact tracing the Department of Health did, and that actually led to the head of the Department of Health resigning this summer. And so we look at all these things to see dysfunction in our local government, and we've got to make sure that we keep our voice up on it, and we don't. We're not just going to sit here and just assume everything is right. We're not going to assume that because we're here in a democratic state that everything is hunky dory. Now we know that the Trump response has been disastrous. We got that comment also from William Murphy, and we agree on that. But that doesn't mean that everything we're doing. We lost 25,000 people here in the blink of an eye here in New York, and there's no question that mistakes were made. Now, I'm not saying that to point the finger at anyone, because the one thing that we'll say that happened in March and April is that everybody was caught unawares. And so a lot of things were learned on the fly. We know that mistakes were made, but what we don't want to do is ignore the mistakes and have them happen again. And so we are very, very critical, and I say critical in a positive way, in that we don't criticize to criticize. We criticize to make sure that we improve. In every situation, it's standard protocols in emergencies that after the emergency, you do a hot wash, after action report, and that hasn't really been fully done yet here. And when we see the mayor taking victory laps about how good the testing program is, we hear a bunch of things about how the schools are safe to open, but we don't see the evidence supporting that. And so there are a bunch of things that we're looking at very, very closely, and we're going to continue to look at. I'm going to say William Murphy. He's been giving us a bunch of things on our Facebook feed, and we appreciate your engaging with us. So we will definitely check back with you offline and share information, and we're going to continue to just get out information. And William Murphy also told us that he's homeschooling his daughter this year, and I understand that. And so we appreciate everyone who's taking responsible steps to keep themselves safe, and we're going to continue to share information. We're here every Wednesday morning starting at 9:30 a.m. live on Facebook, live on YouTube, and we encourage everybody to just stay safe and stay aware.
And before we close, Bob, I can't talk enough about signing that census.
Mm-hmm.
We have always been left behind. We are the hardest workers in our communities, and we get the less funding. And it's because we don't apply, we don't get involved. We've got to sign up and fill out the census. 10 questions in less than 10 minutes. Everyone in your household, even if they're just visiting from down south for a week, should be included. All children should be included. And this census is protected by the federal government. You don't have to worry about there are no immigration questions on there. They're not going to come back and find out who's staying in your home. Fill it out, because that's what gets us our funding for the next 10 years. So if you look in your community and you've seen hospitals closing, schools closing, senior centers, children's centers, and also you see less resources going to a lot of your community agencies, that's why. Because we're not getting the federal funding. It's 10 years. So if you look over the last 10 years and you've seen things slowly declining, and in some cases rapidly declining in terms of resources in your community, it's because we don't have the money to maintain them. It is vitally important, especially now with the crash of the economy. We need that money more than ever before. That may be our only hope in even trying to rebuild our communities. Please, please go to my census 2020. You can just Google it, fill it out, accurately, and send it back. And please, please vote. Go to the Board of Elections, find out about the early voting process, and it is legal now for every single person to apply for an absentee ballot. You do not have to have an illness. You do not have to have any reasoning behind it. You can get an absentee ballot. And at that point, you can find out where that absentee ballot would go. Because that I'm not quite sure if you actually take it to your voting site. But when you
I
go,
would. Well, no, I think the
go there.
the Board of Elections has some locations. We'll find those out, and we'll make sure that in the coming weeks that we have that information also available. Needless to say, we're not going to the post office.
No, we're not going to the post office, definitely.
unless you want your ballot to show up for the 2024 election
in Kalamazoo somewhere.
Yeah.
But the post office, the way things are going now, the post offices may not even be there.
Oh my goodness!
So they may trucks to haul them off that they've been hauling off the postal boxes.
Yeah, it's really crazy. Here's thank you, William Murphy. That's the 2020census.gov is the site that you can go to right now if you haven't filled out your census and do it online. You don't have to leave your house. You don't have to do anything. Just vote, take care of yourselves. That's our message for the day. So we want to thank you for joining us and engaging with us today. From Brenda Riley, the BD has a site near your voting. What's BD? What's BD? I don't know, but Brenda Riley, tell us again what BD stands for.
Is that the Board of Elections?
I would have thought that was BOE, but okay, let's see. Got something here from.
Yeah, that's where we just went there with the absentee ballots.
Right. Good. Okay. All right, we got some very engaged listeners and watchers this morning. We appreciate you. Please share this information with people. Subscribe to us, like us, because that helps us with the Facebook algorithms and sharing. And just get this information out. We do this every Wednesday morning. We give you all the latest updates in COVID-19. We didn't even get into the international ones because this is still a global pandemic. And what we've seen is that it's still raging in a bunch of countries. And we're also seeing that there are countries that have effectively shut this down by using common sense. And so a lot of times there are countries that have not even an ounce of the resources that we have that have shut COVID-19 down. And we should be paying attention to these success stories instead of putting our heads in the sand and pretending that we don't have a problem. I think that's it. I think we're going to wrap this up. Thank you, everybody, for listening. I'm going to go get my first cup of coffee for the morning.
Well, I've been enjoying your coffee for you, Bob, and I want you to know it's excellent.
I'm sure it is. It is.
We're a team. We're here.
So please, folks, join us next week. We will continue to have this information. Stay safe. Share this information with your friends and family. And you know, we wish you know, God's blessing of safety on all of you. And use common sense. That's the main thing. Use the common sense that you were born with.
Absolutely.
All
So
right.
thank you, thank you, thank you, thank you. Stay safe, everyone.